Hello everyone, I am Dr. Mahi Khandelwal from Bhandari Hospital and Research Center. Today we are going to talk about substance abuse and its consequences. Substance abuse is often considered as substance use disorders. Substance use disorders is basically the intake of any kind of substance in the form of injection or in the form of oral abuse or any other kind of injectable supplements. It includes basically marijuana, cocaine, alcohol, sedatives, any kind of stimulants such as caffeine, cannabinoids, opioids, etc. Substance affects your brain and body as well. Now I'll tell about you, and also it affects the psychologically and physiologically. How substance affects your brain? When it targets or when it affects the brain, it secretes the neurotransmitter called dopamine that causes and responsible for the regulations of emotions and the feelings of pleasure. When the higher intake of alcohol, it increases and causes the high feeling of dopamine and affects the high level and urge and the craving mechanism of body. It also affects your immune system. It weakens your immune system. It affects your heart related disorders like increases in the higher heartbeat rate or the severe heart attacks related problems, and also includes the spasm which causes because of the smoking in the lungs, and also affects your skin, also affects your hair and other bodily parts. When it comes to the psychological problems, it affects adversely on the psychological area. That if we are talking about the behavior, how it causes the behavior, it basically affects both behavior, cognitive functions and the memory problems in the brain. And in the how it affects your behavior is basically it makes you more aggressive, irritable, impulsive, and it also has a lot of long-term and short-term effects also. Continuous exposure of any kind of substance can lead to the both mental disorders and physical disorders. Physical can be the any kind of seizures, stroke, and heart attack. And mental disorders, both neurotic and psychotic. Neurotic can be a depression, anxiety, sexual related disorder, personality disorders, and adjustmental disorders. And it can be psychotic like schizophrenia and can develop ATPD, that is the psychotic disorder, form of psychotic disorder. Before assessing any kind of substance intake or any kind of substance related problem, we really need to see the patient's level of intoxication. There are basically four types of level of intoxication. First one is the acute intoxication, that is the transient conditions of intake of any kind of substance and that results in your cognition, your behavioral problems and the perception. The second form is the dependence use problem or dependence syndrome, that is the actual and the strong desire of having any kind of substance. And third includes the level of intoxication is the harmful use. Harmful use is basically that you are continuously exposure of any substance can leads to the different damage effects of the health. It can both physical and as well as mental. And fourth one is the withdrawal state. This is the high intensity problem in the individual that affects after even stopping any kind of substances. Like withdrawal state is very important, and after leaving any kind of substance you have a different psychologically and physiologically effects in the brain and the body. These can be the nausea, abdominal pain, irritability, aggressiveness, impulsivity, etc. Substance not only affects the individuals but it also affects the societies and their work related problems also. Major problems usually in these areas, it affects the students' life also, the peer pressure also, and the majorly the elder people also. It has a major consequences. हमारे यहाँ पे people are taking lot of alcohol. They are so much dependent on the alcohol and alcohol related problems. Despite of their consequences, वो ये चीज़ का intake करते हैं. So it is very important कि हम उन चीज़ों को analyze करें and एक awareness create करें. It also affects not only your bodily, physiologically and psychologically, it also affects your societies as well. For example, if you have seen many times कि कई बच्चे अभी जो start हुए हैं, they are coming to the 12th and 11th and they're not able to understand the peer pressure, and just because of the peer pressure they usually start. Most of the substance problems जो start होती है बहुत early age में start होती है, that we call the adolescent stage and the teenage state. We really need to identify and we really need to see at which state it has started. So it also affects the society also, the relationships also with the spouse, and it can also affect the work related problems. For example, बहुत ज़्यादा late आना work पर because रात को बहुत ज़्यादा excess of intake हो गया है किसी भी substance का, या फिर work में proper concentrate नहीं कर पाना, memory problems होना, and lot of other issues also that can be related to your aggressiveness and impulsivity. So what we can do to deal with these people? So it is very important, when it comes to me first, it is very important to do the screening, as well as also important to start with the psychoeducation. It is the first and foremost aspect to deal with any kind of substance. Psychoeducation is basically the creating awareness about the problem and educating the person and as well as the family members about the illness. So first and foremost is the psychoeducation. The second, it is very important to plan some programs and also need to assess at which stage the person and the patient has. Basically, there are 5 stages of alcoholism, and to assess of any kind of substance, that is the we need to assess it in the screening aspect. Also, बहुत सारे programs चल रहे हैं, that we call the rehabilitation programs. It is very much important to indulge in any kind of rehabilitation program, which is where they focus on the exercise part also and the abstinence of any kind of alcohol for a longer period of time. Also, a lot of prevention programs are also going on in India and here in the hospital also, with the expertise of any clinical psychologist or any counselors to deal with these such problems. So thank you so much for watching me and listening me, and I really wish if someone has problem and someone is suffering from this kind of problem, and even your relatives, your neighbors have this kind of alcohol or any kind of substance related problems, please feel free to contact us at our hospital, that is Bhandari Hospital and Research Center. Thank you so much.